When performing a safety check on the CPB circuit, what must be done to the oxygenator? A. Test the oxygenator for leaks and check for proper oxygen flow. B. Set the oxygenator to the lowest flow setting. C. Flush the oxygenator with saline to remove all air. D. Ensure the oxygenator is connected to the patient's venous line. Correct answer, A. Test the oxygenator for leaks and check for proper oxygen flow. Explanation. Testing the oxygenator for leaks and confirming that it is delivering oxygen properly are critical safety checks before initiating CPB. Oxygenators should be leak-free, and the flow of oxygen must be adequate to prevent hypoxia during surgery. What is the role of the heat exchanger in the CPB circuit? A. To monitor the oxygen levels in the blood. B. To control the blood temperature during bypass. C. To maintain the integrity of the oxygenator. D. To remove carbon dioxide from the blood. Answer, B. To control the blood temperature during bypass. Explanation. The heat exchanger is responsible for regulating the temperature of the blood during cardiopulmonary bypass. It helps maintain the patient's body temperature or induce hypothermia if required for the surgical procedure. Which of the following should be verified to avoid complications before starting the CPB machine? A. The patient's hematocrit levels are within normal range. B. The flow rate is adequate for the size of the patient. C. The arterial line is placed at the optimal site. D. The venous cannula is secured tightly to avoid leakage. Answer, B. The flow rate is adequate for the size of the patient. Explanation. It is crucial to verify that the CPB pump's flow rate is set appropriately for the patient's size and physiological needs. Inadequate flow could lead to hypoperfusion, while excessive flow could cause damage to the patient's tissues or the circuit. Which of the following is the correct action if error is detected in the CPB circuit during setup? A. Continue the procedure and monitor for any changes. B. Increase the oxygen flow to remove air from the circuit. C. Stop the procedure and remove the air from the circuit immediately. D. Increase the flow rate to push the air out of the system. Answer, C. Stop the procedure and remove the air from the circuit immediately. Explanation. If air is detected in the CPB circuit, the procedure must be stopped immediately to prevent the air from entering the patient's bloodstream. Air embolism can lead to serious complications, including stroke or organ damage. The air must be evacuated before continuing the procedure. Which of the following is a potential consequence of failing to properly prime the CPB circuit with heparinized saline? A. Air embolism due to trapped air in the circuit. B. Increased risk of clot formation in the oxygenator and tubing. C. Difficulty in achieving appropriate blood flow rates. D. Poor oxygen delivery due to underoxygenated blood. Answer, B. Increased risk of clot formation in the oxygenator and tubing. Explanation. Proper priming of the CPB circuit with heparinized saline is crucial for preventing clot formation. Heparinized saline ensures that the circuit remains anticoagulated, reducing the risk of blood clotting within the oxygenator, tubing, or other components. During the setup of the CPB circuit, what should be done to ensure proper venous drainage? A. Set the pump speed to the patient's normal blood pressure. B. Verify that the venous reservoir is positioned at the correct height. C. Ensure that the arterial cannula is properly secured. D. Check the oxygenator for leaks and proper oxygenation. Answer, B. Verify that the venous reservoir is positioned at the correct height. Explanation. Proper positioning of the venous reservoir is essential for ensuring adequate venous drainage. The reservoir should be at an appropriate height to avoid negative pressure or collapse of the venous lines during CPB. What is the recommended procedure if a significant blood leak is detected in the CPB circuit? A. Increase the oxygen flow rate to compensate for the blood loss. B. Immediately stop the bypass and identify and correct the leak. C. Replace the entire circuit with a new one. D. Reduce the pump speed to minimize blood loss. Answer, B. Immediately stop the bypass and identify and correct the leak. Explanation. If a significant blood leak is detected in the CPB circuit, the bypass should be stopped immediately. The leak must be located and repaired to prevent further complications, such as blood loss or contamination of the circuit. Which of the following should be continuously monitored during CPB to prevent complications? A. The patient's blood glucose levels. B. The circuit's pressure levels and flow rates. C. The patient's urinary output. D. The temperature of the operating room. Answer: B. The circuit's pressure levels and flow rates. Explanation: continuous monitoring of the CPB circuit's pressure levels and flow rates is crucial for preventing complications such as underperfusion, overperfusion, or mechanical failure. Proper flow ensures adequate oxygenation and perfusion during bypass. What is the primary purpose of the air detector in the CPB circuit? A. To monitor blood pressure during bypass. B. To detect any air bubbles or microemboli in the circuit. C. To ensure the oxygenator is functioning properly. D. To regulate the temperature of the blood. Answer: B. To detect any air bubbles or microemboli in the circuit. Explanation: the air detector is a safety device that identifies air bubbles or microemboli in the CPB circuit. Air embolism can be fatal, so this device is essential for preventing air from entering the patient's bloodstream. Which safety check should be performed on the venous line before starting CPB? A. Ensure that the venous cannula is free of blockages. B. Check that the venous line is connected to the oxygenator. C. Confirm the venous line is correctly aligned with the arterial line. D. Ensure the venous reservoir is completely empty. Answer: A. Ensure that the venous cannula is free of blockages. Explanation: it is crucial to ensure that the venous cannula and lines are free from blockages before starting CPB. Blockages can interfere with proper venous drainage, potentially leading to increased venous pressure and inadequate blood return to the CPB circuit.